Hi everyone, so today we're going to be doing our presentation on how the 2008 Beijing Olympics was impacted by legal frameworks and how this contributed to their corporate social responsibilities and governance requirements. So, our aims in this presentation is to firstly outline the requirements of the 2008 Beijing Olympics, point out those legal frameworks that were considered, and also to explain how the project team complied with these legal frameworks to ensure that the project met their corporate responsibilities and the governance requirements. So firstly, the project requirements that were at hand. So Beijing was selected to be the host city for the 2008 Summer Olympic Games. The event took place from the 8th to 24th of August, and the committee were responsible for building what was called the Bird's Nest Stadium construction project from initiation to completion. So the motto adopted by the team was One World, One Dream, signifying the desire to unify countries through the smooth operation of the Games. So the 2008 Olympics catalysed a major project of urban transformation and new infrastructure development in the capital city. Most of the capital invested in the 2008 Olympics was in fact spent on infrastructure, which has helped shape and foster a greater environmental awareness among the public and was an opportunity to showcase China's commitment to growing in an environmentally sustainable manner. So the Olympics have had a significant influence on Beijing's economic development, environment, and the growth of the country's advertising, television, internet, mobile phone, clean energy, and sports. So first we're going to speak a little bit about the legal considerations at hand. So I'm going to pass over to Amy to speak about those.
So the first legal consideration that China had to consider was earthquake legislation. Due to China's position on the tertiary conversion boundary between the Eurasian plate, part of the Indian plate, and a small part of the Philippine Sea plate, they are required to abide by relevant health and safety legislation to mitigate the damage caused by earthquakes. The Sichuan earthquake on May 12, 2008 resulted in 70,000 deaths and 4.8 million people left homeless, measuring at a magnitude of 7.9 to 8 on the Richter scale. On December 27, 2008, a law was passed to be effective from May 1, 2009, which stipulates that quake-proof standards higher than those for local buildings must be observed for construction projects such as schools, hospitals, and other sites in which people are concentrated, and that effective measures should be adopted to strengthen the capacity of existing buildings to withstand earthquakes. Please you skip to the next slide. So how did the Olympics mitigate this risk? Demonstrated in the image, the outer steel structure of the stadium is completely separate from the inner stadium seating area, which is actually 50 feet apart from one another. This placement allows the two structures to move independently in case of an earthquake. Steel has a rather high modulus of elasticity as compared to the concrete, therefore the entire outer structure could be put together as a unit and withstand earthquakes. The core of the stadium was constructed out of precast reinforced concrete. Because concrete has significantly lower modulus of elasticity, it was decided that it would be split into 8 individual sections. This division allows each portion of the structure to move independently of one another in case of a seismic motion, causing minimal amounts of damage. Beijing's bird nest is designed to withstand earthquakes rated at 8 on the Richter scale. Next slide, please. The second legal consideration is the air pollution. China, more specifically Beijing, is veiled in a layer of photochemical smog which can be attributed to the rapid increase in auto traffic in the last 20 years, within a densely overpopulated city and country. In some parts of China, poor air quality contributes towards shortened life expectancy, and in 2007 the World Bank estimated that between 350,000 and 400,000 Chinese people died prematurely as a result of such pollution. This led to a greater focus on the issue with regards to the 2008 Olympic Games and the detrimental respiratory impact that the smog may have on high-performing athletes whilst in training and competition at the Games. Next slide, please. So how did the committee reduce the air pollution? 3.3 million people with privately owned vehicles were placed on a driving restriction programme where they could only drive on alternate days depending on the digits of their vehicle registration. Major construction works, factories and power plants were closed during the duration of the Olympic Games, and when both of these restrictions failed to have the desired effect, Chinese officials widened the area of factory and driving restrictions to include Tijuana, which has a similar population size to that of New York. Other measures forbid trucks and other high-emitting vehicles from entering the city for a 2-month period, and they replaced 47,000 old taxis and 7,000 diesel buses and began requiring vehicles to meet EU emission standards.
So we're now going to talk a little bit about how Beijing Olympics improved the health services in Beijing and overall the corporate responsibility of the country.
How did the committee improve health services in Beijing? The most significant challenges related to public health included that of disease control and prevention, food and drinking water, hygiene and safety, and public health emergency response. In December of 2004, the Beijing municipal government issued Views on Strengthening Beijing's Public Health Development, which stated the objectives for improving the public health system. These objectives included establishing public health emergency response mechanisms, improving disease prevention, surveillance and control, advancing medical care services, strengthening health inspection and enforcement, and enhancing the public health information system. A series of plans such as the Beijing Pandemic Flu Preparedness Plan and Contingency Plan and the Beijing Public Health Emergencies Contingency Plan were developed. A further 10 public health emergency response contingency plans and 8 prevention and control work plans were also put in place. These targeted major infectious diseases such as SARS, avian influenza, plague, and cholera. These plans were completely reinforced and revised before the Games. A complete public health surveillance network was established in line with WHO technical guidelines. This included a large number of central sites for infectious diseases. There were also public health monitoring sites, including 18 for drinking water contaminants and 8 for food contaminants. Monitoring sites in Beijing increased within the years of 2006 and 2008. These included sites monitoring mosquitoes, cockroaches, flies, and rodents. Beijing also started to enforce health inspections. The health inspection workforce continued to grow, with 492 new health inspectors joining the team between 2004 and 2007. During the years before the Games, China witnessed rapid economic growth. In 2008, the fiscal revenue was 3.3 times more than that of in 2001, which ensured an increasing support from public finance for health development. From 2005 to 2007, the municipal government invested over 4.4 billion yuan into fixed assets for the constructions and health development. Improving healthcare services. So 24 hospitals became Olympic Games designated hospitals and signed the service contract of Olympic designated hospitals. From 2006, the Healthy Games and Healthy Beijing initiative was widely implemented for health education and promotion. A smoke-free Olympic Games health promotion campaign was also carried out across Beijing. Information to promote smoke-free catering businesses in Beijing were sent to 40,000 restaurants in the city. From October 2007, all 66,000 taxis in the city carried no smoking signs. Could we go on to the next slide, please? So, medical and emergency services. So in 2001, when Beijing was awarded the Games, the Beijing Emergency Medical Center, also known as Beijing 120, was then the only medical institute of its kind in the capital. However, despite experiences gained providing medical care in other large-scale events, Beijing 120 did not have adequate emergency care resources, as required by the International Olympic Committee of the Olympic host city. In preparing for the Games, the municipal government made plans based on new laws and regulations, such as the Beijing City Master Plan, Plan for Improving the Emergency Medical Operations in Beijing, and the Candice File. Beijing 120 became specialised in pre-hospital emergency care. In September 2001, the Red Cross Society of China Beijing Branch Medical Center, Beijing 999, was also established and therefore became another major pre-hospital emergency care provider. There was a rapid expansion of emergency medical facilities in Beijing that took place in the years leading up to the Games. Between 2001 and 2008, 165 stations were in operation in Beijing's 120's emergency medical service network. By 2008, Beijing 999 Center had also included 68 stations in its emergency medical service network. Emergency vehicles. From 2004 onwards, emergency vehicles and first aid kits were gradually introduced in newly established service stations. 82 new ambulances were purchased, bringing the total serving in the Beijing network to 465. Beijing's 999 ambulance fleet grew from 102 to 152. All the vehicles used for the venue medical service operations were fully equipped, meeting international standards. Emergency services. Beijing's 120's command management system was updated 3 times. Emergency calls could be handled within 10 seconds, and an international language reception desk was also installed during the games to assist international visitors with emergencies. Could go on to the next slide, please. So, recruiting emergency medical personnel. 746 experienced doctors and nurses were chosen from the Olympic designated hospitals to become medical volunteers at Olympic venues. Training sessions were offered to all the selected medical personnel, the best of whom also took language courses. All these were put in place to prepare staff for unexpected medical incidents and to improve their practical experience. What happened with the Sichuan province earthquake? So between the years of 2006 and 2008, the medical volunteers chosen for the venue emergency medical service participated in 42 Good Luck Beijing test events. In 2008, when the earthquake struck in China's Sichuan province, 297 of the personnel went immediately to the area for emergency transfer operations. As a result, they gained vital experience and were better prepared for the games. Beijing improved its capacity for pre-hospital emergency care. By the time the games opened in 2008, 233 emergency medical service stations with 617 ambulances and 2,105 pre-hospital medical personnel were in operation. During the games, Beijing 120 and Beijing 999 received 93,000 emergency calls and dispatched ambulances 18,000 times. The 2008 Olympic Games, if the Paralympic Games are included, ran only for 4 weeks.
So now I'm going to talk a little bit about the legal considerations when thinking about the water pollution legislation in Beijing. So water is not only an essential source of life, but also a potential carrier of disease. So the World Health Organization lists 27 different waterborne diseases and other hazards. Therefore, the safety of drinking water was a vital aspect of health security during the Games and had an important impact in China after they were over. In its bid for the Games, Beijing pointed out that its drinking water also met the international standards set by WHO. However, some difficulties did occur during preparations for the Games. The water in some areas of Beijing is particularly hard, which is potentially harmful to people's health. So, how did the committee reduce this water pollution? From May 2008, the health bureaus of both the districts and countries were required to provide weekly drinking water quality reports on online quality monitoring, and early warning systems were installed in the water line entering the media village and athletes village in order to detect water contamination and possibly prevent any terrorist attacks involving the poisoning of the water supply. Additionally, 180 continuous 24-hour monitoring sites were set in the Olympic venues. During the Games, public health security team members conducted daily inspections of the water supply system at the venues. An emergency response team was formed to ensure drinking water safety throughout the city, and the team was equipped with testing. Before the Games, 267 samples of drinking water from 112 contracted hotels was collected, and altogether 761 samples were taken, and all of them met the standards. There was also 238 pipeline bacteria testing spots, and the compliance rate of this also reached 100%, and it was overall effective. So, in conclusion, legislation and governance requirements heavily impacted the objectives of the Olympic Committee when planning and implementing the Olympic Games. Earthquake-proof structure of the Olympic Stadium was an important factor to consider when building the Bird's Nest Stadium. This resulted in them being ahead of their time when enforcing earthquake-proof legislation, which was only just implemented later on in 2008. Despite the project team's efforts to reduce the pollution leading up to over the Games through imposing and driving restriction laws, the Games were still branded as the most polluted Olympic Games of all time, and air pollution after the Games was also considered to be worse than ever before. Overall, this affected the corporate responsibility as a host country. Finally, Beijing succeeded in branding themselves as a healthy nation to the rest of the world with their significant improvements made to the health and social care sector. This contributed overall to the official slogan they created, Healthy Games, Healthy Beijing, and therefore boosted their corporate responsibility as a nation. Thank you for listening, and there are our references.